Antacids explained in under 2 minutes. Hi, I'm Dr. Shema and this is MedSpeak. So, how do antacids work? Antacids don't stop the stomach from producing acid. No, they are basic salts that perform direct chemical neutralization. So, unlike PPIs or H2 blockers, which reduce this HCl production, antacids walk into the HCl, react with it, and buffer the pH, which provides near instant relief for GERD, peptic ulcers, or hiatal hernia cases. So, aluminium causes constipation, but we use it in cases of hyperphosphatemia. Why is that? Because aluminium acts as a phosphate binder in the GI tract. It binds to the phosphorus in the food that the patient eats, forming an insoluble complex that gets pooped out rather than absorbed into the blood. So, if your patient has high phosphorus, you're giving aluminium to trap it in the gut. Second, we have is magnesium. So magnesium can cause diarrhea, and we often use it for stress ulcer prophylaxis, especially in patients who are critically ill or in the ICU. Why? Because when the body is under severe stress like trauma or sepsis, blood flow is shunted away from the stomach, which weakens the protective mucosal lining, making it easier for the acid to cause an ulcer. So we give magnesium antacids to keep the gastric pH higher, neutralizing the acid before it can damage that vulnerable stomach wall. Calcium and acid rebound. So this is a very classic exam question, that calcium can cause something called acid rebound. So what does this mean? Your stomach has a thermostat for acid. When you take a lot of calcium carbonate, the pH in the stomach rises very quickly. So the G cells in the stomach sense this sudden alkalinity and think, wait, I don't have enough acid to digest food. So the stomach overcompensates by secreting or producing more HCl. So the patient feels better for 30 minutes, then he feels worse than before. That is called acid rebound. As a nurse, you should always check the renal function before giving these medications, because if the kidneys can't filter these metals, aluminium and magnesium will build up to toxic levels in the blood. Finally, the golden rule of timing. Most drugs need acid to dissolve. So if you give an antacid, you will kill that acidity. To make sure that the patient's other meds actually work, remember, give these meds 1 hour before or 2 hours after the antacid. Let me know which drug class you want to be covered and follow for more.